All right, my name is Susie Artemovich, and I'm going to be the nurse today doing a health assessment on a 22-year-old female. She's Caucasian. She's alert and oriented ×4. She's well nourished and appropriately dressed. She's got no signs and symptoms of distress at this point. I'm going to wash my hands real quick before I start. Okay, we took her vital signs earlier, and I'm going to read off the card. She is 110/60 blood pressure, respiration's 14, temp is 98.4, pulse is 64, and she is 99% on room air. Next, we're going to go to the skin. Her skin is warm, pink, and dry. I'm going to check for any edema and actually palpate for that. You have any swelling anywhere?
No.
No. How about any open sores, lesions, bruises, anything like that?
No.
No? Okay, I don't see any either. Next, we're gonna go to her hands here and check for cap refill on all her fingers and toes. Her bilateral upper extremities are all good, less than 3 seconds on her cap refill. Good there. Okay, I'm gonna check for elasticity.
Go ahead.
Her skin's elastic. She looks well hydrated. Her nail color is pink and smooth in texture. I didn't see any clubbing. Next, I'm gonna go to the scalp here. So I'm gonna palpate her scalp. I don't feel any deformities or anything. Her hair is well approximated. I don't see any bald spots. It's also very smooth. She's got no infestations. Let's see. Her skull is symmetrical. And then I'm gonna move to her radial pulses here. Let me borrow your arm. So she's about a 2+ here, pretty strong. A 2+ here, strong. And I'm gonna do pedal pulses while I'm doing pulses. 2+ there, and 2+ there. Okay, then I'm gonna check out her lymph nodes, okay? So I'm gonna be feeling on your neck and everything. You let me know if you feel any tenderness, okay? All right, so I've got the preauricle right here, and the post-auricle, the submandible, the submaral, and the anterior and posterior cervical back here. Do you have any pain or tenderness with any of that?
No.
Great. I'm gonna check the subclavicular here. Anything there?
No.
Good. So all of her lymph nodes are palpable, non-movable, no pain or tenderness with any of that. Next we're gonna go to the trachea. So her trachea is midline, and no pain or tenderness with that.
No.
No. Then we're gonna go to the carotid pulses here. Okay, they're strong on the left, strong on the right. Then we're gonna check out her thyroid. Do you have any thyroid problems?
No.
No? Okay, so you'll look up for me. Her thyroid, I'm gonna inspect it first. It appears smooth. And then we're gonna palpate a little bit. Okay, it's palpable and normal in appearance. Next, we're gonna go to the eyes. They're symmetric. Her eyebrows have even distribution with the hair as well. And then my pen light is somewhere. Okay. So, can I take your glasses off real quick? Great. So her eyelids are normal in proportion. You can open and close them.
Yeah.
Great. So she can blink on command. There's no ptosis. The sclera is white. The conjunctiva is pink and clear. All right. So I'm just going to check your pupil response here. Okay. That one's equal and reactive. Equal and reactive. They're about a 2 to 3 in size and reactive bilaterally. Then we're going to go to the ears. They're well formed and low set. I'm going to check for any drainage. No drainage. No drainage. She has several ear piercings, so that's one of the things we would want to document. They don't look infected. There's no redness or tenderness with anything. If I push on them, is there?
No.
Great. Now we're going to go to the nose. It's symmetrical in midline. Can you take a deep breath really hard out of your nose for me?
Out of my nose.
Out of your nose. So her nares are patent. Her nasal mucosa is pink and intact and a little moist, which is how it should be. I'm going to palpate her sinuses. So I'm going to just move these for a second.
Go ahead.
Oh, maybe. Okay. You have any pain or tenderness with that?
No.
Okay. Alright. So then there's no tenderness there. So now we're going to go to the lips. Her lips are pink, moist, and intact. I'm going to check the oral mucosa. Can you open your mouth for me? I don't see any dental caries or any open lesions or anything. Do you have any dental appliances like
No.
dentures or retainers or anything like that? So we have no dental appliances, pink, moist, intact, no deviation from the palate, from the midline. Her tonsils were moist and intact, no redness or drainage there. The uvula was also midline, intact, pink and moist. If you had any pain with your throat, swallowing, gagging,
No.
any problems with talking?
No.
No. Okay. Now I'm going to do her respiratory assessment. So I would listen for a full 30 seconds, but for the purpose of the video, we're just going to skip that. So the 5... Oh, sorry. So I'm just going to do a quick listen for the sake of documentation. Make sure we always go on the skin with these. Have you turn this way just a little bit so I can listen to you posteriorly. Okay. So we're going to make sure we listen to all of the lung fields, starting with the apex and moving our way down to the base, and not forgetting the right middle lobe. Okay, so her thorax is symmetrical with chest expansion. It's a normal shape. There's no abnormalities. Her breath sounds were clear and equal bilaterally. Hi, Harley. So then I'm going to move to the cardiac assessment, which the apical pulse will listen for a full minute, but for the video purpose, we're going to just listen for any murmurs or anything like that. Use the bell. So we're gonna I'm gonna listen to all 5 cardiac points. Okay, so we're gonna start at the top towards the right. Oh, hold on, I gotta switch it to the other side for this one. So So the top up here is called the aortic. And then we've got the pulmonic. And then we've got Erb's point. And then tricuspid, mitral. And we're going to listen to all of those. And then I'm going to palpate the PMI, which is this place right here.
Your hands are cold.
Sorry. Okay. So I don't feel any bruise or any pulsations there, so that's good. Now I'm going to have you lie down just a little bit here so I can check out your bowel sounds. Trying to make sure you can still see here. I guess you don't need to see her head, huh?
No.
Alright, so first I'm going to assess her abdomen here. I don't see any scars or any abnormalities other than a really cute dog. So she doesn't have any scars. Do you have any previous stomach surgeries or anything like that?
No.
No? Okay. Then I'm going to go ahead and listen to bowel sounds here. So her bowel sounds are normal active in all 4 quadrants. Now I'm going to percuss a little bit. So her percussion is she's a little dull over the liver and the kidneys, which is totally normal and healthy. I can't palpate any of the other organs. She's had no tenderness. Her aorta is midline without any bruise or pulsations. Like I said, I didn't feel any nodules or masses with the palpation. And now I'm going to check for CVA tenderness. You can sit back up for me. Alright. I feel just kind of
Turn.
yeah, kind of like that. Okay. Okay, any pain with that?
No.
Great. So while I have her back here, I'm going to look at her spine. Her alignment looks good. Can you lean forward for me? Okay, there's no lordosis, kyphosis, scoliosis, any abnormalities whatsoever, so that's good. Alright. Now we're going to test for range of motion in all your joints. So can you stick your arms out straight for me and bend your elbows and then put them back out and then bend your wrists. Can you move? Great. So her range of motion bilateral upper extremities is great. Can you push against me? Good. And then backwards. Good. Can you move your shoulders in a circle? Shoulders are also good. Her shrug is good. So then we're going to go to the lower ones. Can you stick your legs out for me? Great. And your ankles. Can you bend them and bend your knees? Okay. And push your feet against me. All right. There we go. Okay. Now we're going to move on to the range of motion is all intact. Move on to the cranial nerves. So cranial nerve 1 is olfactory. So do you have any trouble with smelling?
No.
No? Any sinus problems or anything like that?
No.
Okay. Number 2 is optic. So I'm going to give you this little card to read.
The dog was in the backyard.
That's correct. So number 2 is intact. Number 3 is your pupils, which we checked earlier, but I'll go ahead and do the little follow my finger test, okay? Alright. Okay, so 3 and 4 are intact. Her pupils move up and down and side to side. Number 5 is the trigeminal, which is the chewing movement. So can you pretend you're chewing something for me? So that one is intact. Number 6 is abductance, which is eye movement, which we checked earlier as well, and that one is intact. Number 7 is facial. So can you close your eyes for me and blink a few times? And can you puff out your cheeks and blow the air out? And wrinkle your forehead? Great. Okay. Number 8 is I always forget these. This is bad. Number 8 is the auditory, and so it's the hearing test. So what I'm going to do is whisper a number in this ear. You're going to tell me what you heard, and I'm going to whisper in this ear and tell me what you heard.
Okay.
Okay?
14.
Good.
27.
Okay. So number 8 is intact. Number 9 is the glossopharyngeal, which has to do with swallowing. So, do you have any trouble swallowing at all?
No.
No? Okay, so that one's intact. Number 10 is the vagus. So, we inspected the uvula earlier in the assessment, but do you have any trouble with hoarseness or anything like that?
No.
So, that's intact. Number 10. Number 11 is the spinal. So we did the shrug test earlier. That was also positive. She did fine there with the shrugs. And another thing we do to check that one is to do your heel down your shin. So take your heel and run it down your shin. And the other side. Okay. And then we're going to check your chin here. So I know it sounds weird, but try to push your chin like against my finger here. Okay, so that's also positive for number 11. Number 12 is the hyperglossal, and we stuck our tongue out earlier in the assessment, so that one's intact. Next we're going to do sensory. So what I'm going to have to do is I'm going to have you close your eyes, and you're going to have to tell me where I'm poking you, okay?
Okay.
Not too hard, don't worry. Alright.
My leg.
Which one?
My right leg.
Okay.
My left leg. The back of my right arm. And the back of my left arm.
Okay. So her sensory is intact. And then we'll move to the DTRs, which I don't have one of those fancy machines, so I can't really check, but typically if something was vibrating on all 4 of your extremities, you would be able to feel it. You know what vibration feels like?
Yeah.
Okay. So I'm going to say that one, sensory is intact. Her strength is good. Her range of motion is good. She has no trouble with feet pumps or grips as well. So now I'm going to have you stand up just to check your gait. Okay, can you take a couple steps for me? So her gait is normal. She's walking just fine. She's steady on her feet and no problems. And I think that's the end of our video.